Hi. Okay, so look at this for a little bit. Um, all right, so now we're going to talk about chapter two, which is on policy implications that drive national quality and safety initiatives. So healthcare is, front and center, correct? Um, and there's a lot of reasoning behind that. Politics aside, healthcare costs a lot of money. A lot of people need healthcare, and it's going to get paid for one way or another. And so, aside from talking about everybody getting insured, because that's not the purpose of this classroom, we are talking today about how policy is now driving healthcare and quality safety. So, why do we care about policy? So, not just governmental policy, but some sort of overreach, correct? So, we all know JCO. Oh my God, JCO's coming. Yeah, I still get palpitations, and I don't really have to do Joint Commission as much anymore. Now, we do have our own accreditors who come in and they give me the same amount of palpitations, but not as much as JCO did. And that's because they are in charge of saying that you are fit to do what you're doing. People can come to you. And without their accreditation, you're really nothing, right? So when you see me glancing over, I'm just looking over at my notes, okay? Just so you don't think I'm crazy. So first things first. So when we talk about policy, we are talking about decisions, whether they're legislative or from an organization wide, on how best to carry out certain aspects in order to meet a goal. Okay, it's kind of a set of proposals. All right. Policy encompasses alternatives that include not only legislative action, but rulemaking, statement policies, standards, adoption of guidelines. Okay, and we have these policies in place in order to make sure people are following the rules, and also that people understand what they're supposed to do. I can tell you that when I have to do something new that is under my scope of practice, I will bring out policy and procedures to make sure I'm doing it correctly. But also, what's important to talk about policy is not just what it is, but who is shaping it. And nurses play a big role in shaping policy. And it's really important that we remember that, especially now. We have a voice. I'm sorry about my dogs. We have a voice that's going to help shape policy and figure out solutions to the care gaps and quality issues that are very pervasive in our healthcare setting. Um, so greatest policy changes grow out of coupling problems, policy proposals, and politics. And it's not just governmental politics. It also has to do with politics within your organization. So one thing that's really important to understand is stakeholders. So for some of you who don't know exactly what stakeholders are, it's anybody who has stake in a project, anybody who benefits from whatever is going on. So we're going to talk about it from a healthcare standpoint. So stakeholders from a healthcare standpoint. So investors, right? The community, because if you have a healthy community, you're going to have less crime. Patients, they're stakeholders, right? You as providers, clinical providers, nurses, doctors, nurse practitioners, PAs, I mean, I can go on, are stakeholders. And of course, insurance companies, things like that, they're all involved. They're all considered stakeholders, and their level of necessity or importance will rise and fall depending on the project. And it's broad for a reason because it incorporates so many just different aspects of healthcare, even federal agencies. And like I said, sometimes they take higher precedence over others. It just depends. All right. So before we get into talking about healthcare quality and all that with policy, we have to talk about the Affordable Care Act. So in 2010, the U.S. Congress passed a law called the Affordable Care Act. So there's a lot of things that are controversial. I'm not going to get into that part, but what I really want to talk about, and most people don't know because it's not really politicized, is that there was a whole bunch of information on quality and safety improvement and funding for that, and also just holding it to a high standard. So there were laws in there that were saying, the delivery of healthcare has to be safe, it has to be accessible, it has to be effective and affordable. And we have to find ways to support that to happen. Nurses are critical in designing and supporting innovations in care delivery, okay? And we implement most of the time these improvement measures. So, nurses are the heart of healthcare. And I'm not just saying that because I'm a nurse and I'm proud to be a nurse, but you need to think about it like this. Every healthcare setting has a nurse, and without the nurse, it would fall apart, correct? If you go to the hospital and there weren't nurses there wouldn't be a hospital. Because the reason why someone gets admitted somewhere is not because they need an advanced provider, so an MD, a DO, a PA, an MP, but they need nursing care. They need that one-on-one, centralized, acute care. The same in the outpatient setting. Most of it all depends on, okay. So let me just get some more of my notes out. Okay. So Medicare and Medicaid have been trying to pilot ways that we deliver care to patients, and all of that is going to be surrounded by outcomes and quality improvement projects. So the Affordable Care Act provided incentives for providers to join together to provide better coordinated care, and part of that comes from the patient-centered medical home. And now that you're going to see that payment for medical treatment is going to be based on value, and that's going to affect all of us, right? So if we don't provide good outcomes, we're not going to get paid the same. And it's not really going to be contingent on the patient's actions, which when I first heard about it, I was freaking out. Like, okay, well, if my patient doesn't take his medicine, why am I going to be punished for my patients having high blood pressure? But it's more based on what we do to ensure that we're doing everything we can to get someone's blood pressure down. So a few provisions that we're doing for partnerships. So keeping hospital patients from getting injured or sicker, readmission rates, which I know is important, helping patients heal without complication. We talk about now in the inpatient setting, if somebody gets a fully induced UTI, it's no longer covered. And part of that is to motivate Foleys from coming out earlier. And of course, on our end, it's like, well, man, the Foley is really actually helpful for skin integrity, or someone's not ready to get their Foley out. So there's both ends to see on these measures. So national quality strategy for the future. So there was an initiative called the National Quality Forum and National Priority Partner Goals and Priorities. And the National Quality Strategy is pursuing 3 aims, okay? One is better care. So improved overall quality of healthcare. All right, so making the patient centered, reliable, accessible, and safe, okay? Healthy people, healthy communities. We see healthy people 2,000, 210, 220. And soon it's going to be 230. And it's to improve the overall population health. And you'll learn more about that in your community class. And affordable care. So reduce the cost of healthcare for individuals, families, employers, and the government. So how do we do that? Well, making care safer. When we have med errors, when we aren't safe with the care we provide, it's very costly to drive up healthcare cost. Ensuring that it's patient and family-centered care. And I know that from the nursing aspect, sometimes it's like, okay, well, how much family-centered care? But it's in a way broader view in terms of looking at the patient as a whole and involving them so they're empowered in their own care. I have many patients who come in and they don't know any of the names of their medicines. And they say, well, you should know the name. I didn't do it because you didn't tell me. And part of it is helping people take action in their healthcare. For me, I do that. And I'm sure you do it too, and help your family out. So for my mom and dad, if they say, what's an example? My dad has really bad Crohn's. And I take all this initiative so that he gets the best care possible because I know better. And the more educated you are, the more likely that you're already practicing your own patient-centered care. But for those who are marginalized or don't know any better, that doesn't happen. And so that's kind of where we talk about that. Promoting effective communication and coordination of care. Okay, great. So somebody sees a cardiologist, we need to make sure that care is coordinated. And then working with communities to promote wide use of best practices to enable healthy living. So there's higher asthma rates in urban areas and in older housing. So if we have HUD housing in these very old houses, what are we doing as a community to prevent asthma admission rates? Are we going to do some mold cleaning? And how do we support that as a community? Are we going to pay for it? Are we going to give tax incentives to the HUD housing owners or to the cleaning companies to give discounted mold removal? And that's something you look at to promote best practice within a community. And then making quality care more affordable. So there used to always be, people tell me this all the time. Well, I guess I get, I mean, I shouldn't say they tell me this all the time. I've heard this. I'm getting what I pay for. And I say, no, I'm giving you quality health care. um, that makes me sound really bad, but I've heard that. Or where people say, well, I didn't get very good prenatal care because I went to Planned Parenthood. Well, the care you get at Planned Parenthood should be the same you get at your boutique doctors. So that's kind of that idea.